This slide is from the trachea. We have 4 layers to the trachea, right? We have the mucosa, submucosa, hyaline cartilage, and adventitia. So this is on scanning on my microscope. This layer here that is intimate with the lumen of the trachea would be the mucosa. And I'm going to magnify this in just a moment, but this way you can see all the layers. So here's your mucosa. Below this dark line here becomes submucosa. This, of course, is hyaline cartilage. And then anything outside of the hyaline cartilage here in this pink kind of a tissue, this is going to be the outer connective tissue of adventitia. And you know this is the outside because what is this? This is adipose connective tissue. Remember, fat tissue stores energy, cushions, and insulates organs. So that gives you an indication like outside, inside, right? Mucosa, submucosa, hyaline cartilage, and adventitia. Right, so if I magnify that and I'm going to go to low power, right, we'll be able to see a little bit better the tissues that constitute each layer. Is that good? Mm-hmm. Back of the area will look different than when you're close. Okay, so this layer here, this is your mucosa, and the tissue is pseudostratified ciliate columnar epithelial tissue. There are a few goblet cells thrown in here. And the function of that tissue is that it traps pathogens. It helps, it's cleaning the air that's entering your respiratory tract. It wants to clean it of pollen and dust and so forth. And the cilia on the surface beat in a singular upward direction to keep that mucus flowing up and out of the respiratory tree so it doesn't all fall into like the alveoli. So it needs to be cleaned and moved all the time. Below that, here's a nice little layer in the submucosa of areolar connective tissue. And these are mucus glands that produce mucus that becomes secreted onto the surface. And that is simple cuboidal epithelial tissue. So the simple cuboidal, these glands, it produces mucus, for the surface of the trachea to, help clean the air that you breathe and filter it, trap pathogens. Remember, mucus is always that first line of defense in immunology. All right, and then we have, let me look at this side. Now we have here our hyaline cartilage, right? When you see chondrocytes in their lacunae, the matrix it stains a light pink, light lavender kind of a color here. It's devoid of any visible fibers. So that is your hyaline cartilage, and it's the hyaline cartilage portion of this that maintains a patent airway in the cartilage, also in the larynx, maintains a patent larynx. It keeps these tubes open. So in the larynx, the cricoid cartilage, thyroid cartilage, arytenoids, they're all hyaline cartilage, and they have certain functions there, mostly to just keep the airway open. As we get into the hyaline cartilage in the trachea, it helps keep the trachea open and patent so it doesn't collapse. Then to the outside here, we have areolar connective tissue that composes generally adventitia, and any outer connective tissue layer always has virtually the same function. It acts to secure the organ in its location. It helps secure artery, blood vessels, and nerves and lymphatic structures to that structure so it doesn't avulse. So it's really the same. Okay, let's go to a lung. Once you're in the lungs, those little repeating structures that you can see there, I'm going to look around for a nice bronchi. That with all the grainy goo in the middle must be a blood vessel of some kind. All right, so let's go here. Let's go down a little bit first. We'll go down to skin so you can see a little broadly. Okay, so the majority of those little web-like structures are the alveoli. They are composed of simple squamous epithelium. This is where gas exchange occurs. Don't worry about whether it's a type 1, type 2, which one makes surfactant, that's more lecture. But these are alveoli. So look, when you see all these alveoli, now you know you're in the lungs. And once I'm in the lungs, the only other vessels, or not vessels, but tubes you have to identify is the difference between a bronchi and a bronchiole. All right. Histologically, this is going to be a bronchi. Now, a bronchi is almost identical to the trachea. It has a mucosa, thin submucosa, hyaline cartilage, and then very little connective tissue on the outside. So this has, the mucosa has piscic, pseudostratified ciliated columnar epithelial tissue, then a little bit of submucosa here with areolar connective tissue, and a little bit of cuboidal because you have to have this mucus line. And then we have hyaline cartilage. So you might not see hyaline cartilage all the way around, but if you see it on one side of this tube-like structure, then you know it's a bronchi, because bronchioles don't have hyaline cartilage. They're going to have smooth muscle because they can bronchoconstrict and dilate. Right? So I would, if anyone asked you to identify the structure, you would say a bronchi, because you can see some hyaline cartilage. And that's the easiest visual, differential, so to speak, as to, because clearly it's not an alveoli, is whether you have a bronchi or a bronchiole. Now, a bronchiole will be devoid of, and generally a little bit smaller, but sometimes they're pretty broad. You just won't see any hyaline cartilage. It's a little difficult to differentiate the mucosal tissue like that, because if we have it on that level of magnification, you can't quite see the forest through the trees. But yes, in a bronchiole, the mucosa will change to simple cuboidal epithelial tissue, and you swap out hyaline cartilage for smooth muscle, because they can bronchoconstrict and bronchodilate. So if you're looking at a structure that you can't see any little hyaline cartilage pockets around, then you know it's a bronchiole. I can show you one that's on another slide, but I think you're going to be fine, with just knowing that. It looks almost the same. It's a little bit like this one, questionably. This is probably a bronchiole because I can see it involuting like crazy here. That means that it's relaxed and it's capable of stretching and expanding. This is going with something, another structure, another bronchi, probably someplace. But this is more than likely a bronchiole. But I would choose one that has no hyaline cartilage even close to it, really. So it makes your recognition of it kind of fair. All right, so alveoli, gas exchange, bronchi, transport air into the lungs, from the trachea, whatever. The hyaline cartilage there maintains a patent airway. And then when we get to bronchioles, then we have, bronchoconstriction, bronchodilation. And then we have gas exchange at the alveoli. And that's the last slide.